Hi, I'm Ken Cutbush, an orthopaedic shoulder surgeon working in Brisbane. I'm with Lucy Angelini, a shoulder physiotherapist, and we're talking about post-op rehab for acromioclavicular joint reconstructions, or ACJ reconstructions. So ACJ reconstructions are typically done after AC joint dislocations. As a general rule, some type 3 AC joints I will reconstruct, but we're more looking at the higher grade AC joint dislocations. Saying that, there's the occasional type 2 that long term down the track doesn't go well with rehab and does need to be reconstructed. And so we do see those occasionally too. But they're not acute, they're always down the track in chronic reconstructions. So this is something where I reconstruct the corticoclavicular ligaments and the acromioclavicular joint. I generally will do a orthopedic stabilization or fixation of both components and then use tendon allograft to bring in biological fixation for both the AC joint capsule and the corticoclavicular joint, corticoclavicular ligament reconstructions. So it will be generally an arthroscopy followed by an open approach to the shoulder. Now, the morning after the surgery, because you'll be in hospital one night, you'll see the physio, of course, and the nurses will check your dressings. Typically, you won't necessarily need your dressings changed, and you will have an x-ray before you leave hospital. You'll also have a sling. The sling, we will fit you with a sling that has a bolster underneath it, and that bolster can actually come off. It depends what's most comfortable for you. So we will give you the sling that is like that, and then with the physiotherapist in hospital, the hospital physio, you need to check that and see what's more comfortable. The bolster will just Velcro on and off. And at this hospital, you'll be discharged about 10 a.m. so that you can plan for that. And you're going to be in a sling for 6 weeks, so it's very important to get that sling fitted well and know how to put the sling on and off. The physio will also take you through how to shower, how to put a shirt on, all those sort of things. But what else are they going to do in hospital, Lucy?
So they'll show you some really simple exercises. So physio is quite low key for the first 6 weeks while everything's healing. But we want to make sure that your hand and your elbow and your neck don't stiffen up as a result of being in the sling.
Yeah.
So we show you some gentle range of motion exercises for the adjacent joints. And like you said, help you with all your activities of daily living. So making sure you're independent with taking the sling on and off, with a shower sling and with dressing. And then in terms of the shoulder, you'll be shown some gentle passive range of motion exercises. So a pendulum.
Can you demonstrate that for everyone?
Yeah, I'd love to. So having your non-operated arm resting and just making sure you're bending forward and letting your arm hang away from your body. So it's passive, not active. So your shoulder's nice and relaxed when you're doing it. And then also some external rotation. So because you're sitting in an internally rotated position in the sling, it's nice to make sure that you don't stiffen up. So we teach you how to stretch your hand away from your tummy.
Yep, because there's the glenohumeral joint or the ball and socket joint of the shoulder, and we want to keep that moving, and there's no restriction with that movement. It's the acromioclavicular joint that we're concerned about. And the big thing there is elevation. We do not want you lifting your arm up, either to the side or to the front for the first 6 weeks. And it will be 3 months before we will be suggesting that it's okay to lift your arm above shoulder height. So heads up.
Yes, yeah, it's a long time, but it means that it gets a nice chance to heal.
Yeah, and I think that's been a big difference. And it's rare these days to see the acromioclavicular joints starting to stretch up, which they all tend to do a little bit. But if there's a lot of movement, particularly with the overhead, that will just start to pull the repair apart and stretch it up too much in that early time. It needs 3 months to get solid and to get some strength to it. So when do we suggest that they see their physiotherapist?
So normally it's a good idea to see your physio around the 2-week mark. Just they can check the wound, make sure that all looks okay. Go through your exercises because often there's a lot going on in hospital and it's nice to have a little refresh. They might do some soft tissue work because being in a sling and not moving means you stiffen up a bit. But there's not a lot of input in that first 6 weeks. We just want you to be quiet, do your gentle exercises and let it all heal.
Yeah.
Yeah.
So the 6 weeks is the first visit back to see us. So what do we do at that visit? Obviously we say hi and go through everything.
Yep. Make sure that the AC joint's looking nice and
Yes, you'll get
level.
an X-ray.
Yep.
There'll be an X-ray taken at that 6-week visit to check that it hasn't been stretching up and it looks good.
And we wean from the sling. So that's exciting. You get to come out of the sling for all your normal day-to-day activities. So we encourage light use. We want you to use your arm to eat and wash and dress and groom and all those things. We just don't want you with any significant weight in your hand, so nothing much more than a cup of tea. And like you said, the main thing is that you don't lift your arm up above horizontal.
Yeah. So even though we're taking you out of the sling at the 6-week visit, 6-week appointment, and that could be done either in person or via telehealth. They work quite well with telehealth if that's more appropriate for you if you're out of Brisbane. We don't want you lifting your arm above shoulder height, either up to the side or up to the front. That's the big thing, really, I think, at that 6 weeks. So between 6 and 12 weeks, you'll be out of the sling and you'll be doing a lot more in terms of rehab, but no elevation, no lifting of your arm above shoulder height.
That's it. And then at the 12 weeks, we're hoping when you come that your pain is controlled, you're sleeping well, you're comfortable below shoulder height, and then we start to get your range of motion back. So we work on getting you from 90 upwards, and
some people can be tired and some people not. Hey, it is a bit
all
variable,
is
isn't it?
normal.
Yes.
Yeah. It comes back at different speeds for everyone, but it does come back.
Yes.
And
we've never seen anyone that didn't get their range of motion back, have we?
They come back. Yeah. The movement gets there. Sometimes it just
so it's much better
longer.
to concentrate on getting a good result from the reconstruction and getting that solid than worrying about range of motion, because the range of motion always comes back. That's certainly, and that's backed up by our personal experience with that.
Yeah. And then once you've got good range of motion, then we can start getting you strong again. Yeah. So working towards whatever your goals are, whatever sport you want to play, what work you need to do, getting you nice and strong for whatever you need.
Yeah. So when do they start in the gym?
So once the range of motion comes back, then they do sort of a few weeks of rehab kind of strengthening, getting the rotator cuff and scapular stabilizers working, and that normally takes a few weeks, and then they can start back at the gym, initially strengthening their backs, so a lot of pulling kind of exercises,
shoulder shrugs, things like that.
All those beautiful exercises, and then progressing under the care of your physio to some pushing, and then eventually some lifting and pushing overhead, but we leave those until the end.
Yeah, that's not going to be before 6 months. All that comes after 6 months. So there will be another X-ray at 12 weeks, and we see you back at 6 months, typically with another X-ray as well. And that's when we really start to ease up on any restrictions, isn't it?
Yes.
At 6 months.
Yeah. Prior to that, we don't like them loaded too much because they do tend to stretch the more you do.
They do, yes. That is one of the features of an AC joint reconstruction. They do tend to stretch up if you load them too much or move them too much. And so we do need to be, the reason to be quiet in that first 6 months is to avoid that, because you want the best possible result with your shoulder.
Absolutely. Yep. But after the 6 months, lifting overhead, we start to progress to those kinds of things.
And I would say contact for me is 9 months minimum.
Absolutely. Yep.
In terms of contact sports, if that's
what
you're into. What else? Anything else there?
No, they tend to do quite well. It's just a bit frustrating at the beginning because it's so slow, but it's just worthwhile.
Yeah, well, shoulders are slow, aren't they? So that's a look at the rehab post-op for AC joint reconstructions. Thank you.